Okay, so we'll just get started. I think there's 118 people watching now. So Medicins at Dundee. So we're a student-run society based at the University of Dundee, and we provide medical work experience to local pupils based in Tayside, which is in Scotland. So we've been running for around 10 years, and every year, 3 work experience weeks for S5 school pupils. We run an Exploring Careers in Medicine day for S4 pupils, and we run an Exploring Careers in Healthcare evening for S1 to 3 pupils. So we have lots of experience in helping pupils apply to medical school. So for the workshop today, so first of all, I'm going to talk through the common interview styles used by medical schools and also the common stations that tend to come up in MMIs. And then what we're going to do is go through 3 example stations. We've made them quite interactive. We've made polls that you can participate in. And then we'll leave 5 minutes at the end for closing in questions. So I'll talk for 10 minutes now, and then each station should take around 10 minutes. So why do we interview for medical school? So there's several key attributes that are required to be a doctor. So you have to be professional, you have to be good at communicating and talk to people. But it's difficult for medical schools to kind of assess these from personal statements. So the best way to test these attributes is to invite everyone in, meet them in person, and do an interview. So there's 2 different key types of interview. So there's traditional interviews and then multiple mini interviews. I'll briefly discuss traditional interviews, but the workshop is based on multiple mini interviews. So traditional interviews. So this is what the University of Glasgow runs. So you have a panel of staff interviewing you. They tend to ask you questions like, why do you want to study medicine? Why would you be a good doctor? They can go through your personal statement, ask questions about your work experience, that sort of thing. They can ask you ethical questions. And it's quite predictable, but you either only have 1 panel or 2 panels, so you don't really get many fresh starts. So if you are nervous on the day, you mess up your first panel, it's not very forgiving. But Dundee runs the multiple mini interviews, so this is where you rotate around a number of stations. So at Dundee, there's 10 7-minute stations, so you're there for 70 minutes total, which sounds like quite a lot, but it does go by quickly. It's a more popular and modern form of interview, and it's used by the majority of Scottish medical schools. So if you go to the next slide, Calum, we'll go through some of the types of station. So although you broadly get kind of traditional interviews and then MMI interviews, it's important to be aware that you can have traditional stations at an MMI, if that makes sense. So you could have one station where it's just you and an examiner and they're asking you why you want to study medicine, or they ask you about your personal statement, why you want to go to that university, that sort of thing. You can also get ethical stations, so they can ask you about current issues, they can give you scenarios and ask what you would do. And then you also get the fun bit, which is where you have to interact with an actor. So these can be broadly kind of one of 2. So firstly, you can have a role play situation where you have to perform a task with an actor, and they'll be deliberately kind of pushing your buttons and trying to be annoying, and you have to kind of complete a task with them. And then you can also get communication stations where you have to explain something or go through something with them. But they're quite fun, and it does make the whole thing pass quite quickly. So we've written down some top tips for MMIs from our committee. So one really important thing is to just be really enthusiastic and friendly and smile. I think a lot of people think that medical school interviews are very serious and you have to be very kind of intense, but MMIs are about meeting you and you being enthusiastic and friendly towards the actor particularly. So showing good active listening, making good eye contact with whoever you're speaking to, nodding along, having good body language is all really important. Dressing professionally is also important, and I think a lot of people worry about this. So for girls, I think we would just say wear a smart shirt or a blouse, a skirt or smart trousers, and smart shoes. For guys, I don't think you need to be in a full suit, but as long as you have a smart shirt, smart trousers, smart shoes, then you'll be fine. In the actual stations, if you're stuck, it's okay to just take a minute and think. You don't have to just keep rambling the whole time. No one's going to judge you if you just take a minute to think about what you want to say. It's important to not swear and be rude to the actor. So at Dundee, I've assessed stations where people have come in and kind of laughed at the scenario and laughed at the actor. And that's absolutely the wrong thing to be doing. Even if you think whatever they're worried about is trivial, you should still kind of acknowledge that it's important to them and don't be rude to them. A common question is why you want to study medicine and not other healthcare degrees. So make sure you have an answer for that. Another common thing, particularly for the communication stations, is the examiner will ask you at the end, what do you think went well and what didn't go so well? So be aware of yourself and what you're saying throughout the station so you can comment on that at the end.